What you've got to do here is protect, and this is with the price, much more important than maybe some of the other injuries that you might have. You've got to protect it. Now, people will argue different things. Some people will say you brace them, some people will say you don't brace them. I would brace them, just because I think as well the player feels much more secure, I suppose, when they have a brace on, and also you don't want too much movement going on within that joint. Now, if everything else has been, or if anything else has been damaged at the same time, which can quite easily happen, then I might put them in a different kind of brace. But if just the ACL has gone, probably I would put them in a knee brace. You want to protect it a little bit, so you've got to go onto crutches. You're going to make it relatively partial weight bearing, until eventually the knee joint settles down. Now, quite often they will leave surgery in an ACL for maybe 2 or 3 weeks to let all the swelling calm down, and then they will go in and do it. They don't always do it immediately. The only times they'd ever go and do it immediately, more likely, is if they think other things have been damaged, because it's much easier to do the operation, I think, when there's no swelling around. So you'll quite often find that within, you know, those initial stages are getting the swelling down. That's your aim, and then if a surgeon is going to repair it, then after sort of 2 or 3 weeks, he will then go in. But they might be walking around, and they might be walking around absolutely normally, without a brace or without anything on by that stage. There are lots of people out who've had ACL injuries that have never had them repaired and are absolutely fine. And so you don't always have to have it repaired. I know in professional sport you generally do, and I think you probably do at that level because of the cutting and the twisting and turning. But I think that's why when it gets to that sort of 2 or 3 week mark, they can, as I say, present relatively normal as a normal knee. The only thing will be is they don't have an ACL, and it would have been ruptured, so that's when the repair is done.